The regional nerve block is an important component as part of your overall pain management protocol. It affords us many, many benefits, and some of you may already be doing these regional blocks. Some of you may be apprehensive. There are some urban legends out there and some horror stories that you may have heard that prevents some of you from performing these. This is something that I absolutely believe that technicians, number one, can master this technique and should be administering regional blocks. It makes you much more valuable in your dentistry service if you're able to do this. And these are pretty simple to learn, more so than what you might think. We're going to give you very specific anatomy and very specific landmarks, so there's no guesswork when you're administering these blocks. And the benefit is so huge that it far outweighs the risks and the complications, which are pretty minimal. I've been doing regional nerve blocks for almost 15 years and have yet to see any adverse reactions at this point. There's a lot of benefits not only to the patient but to the client and client compliance, which we're going to talk about a little bit. We're going to talk about some agents, we're going to talk about anatomy, and then we'll talk about the technique itself in getting these accomplished. Let's talk about some client education. I talk to clients every day. Exclusively dentistry now that I'm in a specialty practice, but when I was in general practice, we talked dentistry quite a bit. Our annual exams, of course, we were doing oral exams and recommending dental cleanings on a regular basis, dental cleaning and assessment. And so when you talk about dentistry, of course, it follows the next thing you're going to talk about is anesthesia. And there have been surveys done that have shown that the number one client issue with following through with professional dental care is not cost. It's the fear of anesthesia, and I think we all know that. That's a big hurdle to get over. Trying to talk to that client who has a 12-year-old early renal patient to do anesthesia, that it's going to benefit from having all of those infected teeth extracted and getting that mouth healthy. It will affect their quality of life and in some cases extend their life. But sometimes getting over that anesthesia hurdle can be difficult. Regional blocks, believe it or not, will help you do that. And so my conversations tend to go this way. I get a lot of calls from folks who, I've had my dog's teeth cleaned and gosh, he just didn't do well under anesthesia, or it took him a very long time to wake up, or I'm just so scared of the anesthesia, I just don't know what to do. And so I let them know that in our dentistry service, we do anesthesia a little bit differently. When an animal comes in for a spay, that's an abdominal surgery, and they have to be under anesthesia at a fairly deep level of anesthesia, a fairly deep level or plane of anesthesia. And in dentistry, we actually can keep them fairly light because we're only working in the mouth. And so most of our patients still have an eye blink or palpebral reflex. They still have a swallow reflex to some degree. And so we can avoid those complications that are often seen during deep anesthetic episodes. Decreased blood pressure, decreased cardiac output, decreased temperature, and other complications that we see from anesthesia. And when we keep them very light, a couple of things happen. Number one, they recover much quicker.